When health workers started dying from COVID-19, they seemed to be disproportionately from Black, Asian and minority ethnic backgrounds. Now politicians have started to ask questions about it.
We need to urgently investigate why people from BAME backgrounds appear to be more at risk from coronavirus.
There does appear, as you say, to be a disproportionate impact of the virus upon BME communities.
The government has already launched an inquiry into what's going on here, and the BMA has raised concerns too about the reporting of the data. But what data do we actually have on this? The latest NHS England numbers show that 18% of those who have died in hospitals after testing positive for COVID-19 were from ethnic minority backgrounds. That compares to the last census in 2011, which showed 14% of people were from Black, Asian and ethnic minorities. But there appears to be a starker difference in intensive care. Those data showed that a third of those in intensive care with COVID-19 were from ethnic minorities. These are only two data sets. Studies from around the world are looking to see if there are specific risks of severe COVID illness in certain communities.
I think there are some uncertainties, and I think that's why we really do need to firm up these data. There's two sort of broad factors, and it might be different in different sort of communities. One may be that there's a social element to this, in the sense that certainly, for example, in the South Asian community, the way they live their lives is much more family orientated, and perhaps the social distancing aspect has been more difficult for them. The second part could be that once they have had the virus, and even for the same level of viral infection, their capacity to perhaps cope with the immune response that comes from the virus is diminished in some way. And we know, for example, there are biological reasons that these communities are at high risk of diabetes. There are biological reasons, for example, that they're at high risk of other chronic diseases. And thus their capacity, or their buffering capacity, as it were, to cope with the infection and with the severe infection that happens may be somewhat less than perhaps in the white community.
While studies are ongoing, medical advice for those communities and the general population is to socially distance and try to exercise and have as healthy a diet as possible.